What's going on, guys? Medicine in 3 minutes, back here with another video, and today we're going to be talking about Parkinson's. We're going to keep the subject clear, brief, and illustrated, so let's get started. So, what is Parkinson's? Parkinson's is a deep progressive disorder caused by the degeneration of dopamine producer neurons in pars compacta of substantia nigra. Now, about 1% of people over 60 years old will develop Parkinson's. The cause is often unknown, so we still haven't figured out why it happens, but in some occasions, very rarely, it is genetic, which is related to the mutation of PINK1, Parkin, or alpha-synuclein genes. Now, again, there's another exception, which is in some cases it can be toxic, which is the recreational drug MPTP. So yeah, what are the symptoms? So the first of the common symptoms you'll find is resting tremor, by opposition to acting tremor of the cerebellum. So this is more of a, as you can see in the diagram here, it's more of a shakiness. Cogwheel rigidity. So the movements are very robotic, they're very stiff, they're very rigid, and joint movements, maybe even when you're going to grab a cup, moving your hands, trying to take a step, etc. Akinesia. So by opposition to essential tremor, it's pretty self-explanatory what akinesia is. Again, postural instability. So again, as you can see in the diagram here, there isn't very much stability in one's posture. Sometimes it's straight, sometimes it's hunched. There's not very much control over it, and there's an absence of weakness. So there's very weak joints, and the motor cortex and the corticospinal pathway is very affected. Now, other symptoms that are actually caused by the prefrontal lesions, so it's just part of the brain, disturbance in acetylcholine neurotransmitters, are depression, dementia, sleep disturbance, and difficult smelling. What are the treatments? So the main treatments that you can find for Parkinson's are basically any form of increasing the dopamine in the brain. So you can use antiviral or amantadine, which is a dopamine agonist, so it'll increase your dopamine, or bromocriptine, again, that can be known as fungal or derivative. That can also increase your dopamine, or an anticholinergic, which helps with tremor, so it'll slow down some of the side effects. An example of that could be benztropine. Again, any inhibitor of COMT, which is catecholamine methyltransferase. An example of that could be tolcapone, or an inhibitor of MAOB, which is methyl oxidase B. An example of that could be selenuline. So yeah, that about sums up this episode of Medicine in 3 minutes. Make sure you check out Butchered Gardens in Eden of the Pacific. You can find it on Amazon, Kindle, and Kobo. It's available in virtual electronic form. So definitely go check it out. It's very accessible, very amazing book. It features some really beautiful photography from Victoria, BC, Canada. It shows really the beautiful nature you can find in the province. So yeah, definitely go check it out. So thank you guys so much for watching. Make sure to leave a like and subscribe, and don't forget to leave comments down below. Let us know what we did wrong, if there's anything we can improve on, if there's anything that you guys want for the next videos, anything that you want us to help you out with, definitely let us know in the comments below. So thank you guys so much, and have a great day.